More than 130 people a day die from opioid-related drug overdoses, and the numbers are constantly increasing. Here to educate us about this epidemic is Dr. Kanika Turner. Welcome, Dr. Turner.
Thank you.
So you're St. Louis, born, raised, and trained, medical
Yes.
school at St. Louis
Yes.
University, and you are doing amazing things in our
Thank
community.
you. Thank you.
So right now you're working on the opioid, the program through the state of Missouri.
Yes.
And with the Family Health Center. Is that right?
Yes.
So tell us why opioid? Why are you interested in that in particular?
Right. Well, it's a huge need, and going through medical training, unfortunately in medical school we don't get too much training in this, and actually when I started practicing, one of my colleagues sparked my interest. So when I was a resident, kind of took out time with me, Dr. David Glick, he took out time with me to, to teach me a little bit, and just the more I started practicing, the more I saw the need that our people are dying.
So Dr. Glick, he took you aside and said, we've got a health issue that I want to tell you more about. Is that what?
Yeah, so he started working with me like one-on-one. Like I will see patients with him, or we admit patients to the hospital. So he was very, very, for me, like a mentor in this area. And I just saw the need that not too many physicians are treating now. Mostly it was psychiatrists who were trained. I'm family medicine trained. And so for me, it was just a passion, something different, and to help the community. Especially in the Black community, substance use, drugs, alcohol. It's been a plague for years and years and years. So I hope to create a change.
Yeah, so it is something that I've known that a lot of family medical doctors, family doctors aren't trained in.
Right.
I mean, that is definitely something that we see. So what do you feel why do you feel that you can make a difference?
Oh, I think the one thing, I'm just passionate about it. I think when you work with an area like this, you need to get rid of all of the myths, the stigma, and just have that passion to treat, take care of people, and save lives. And so there are plenty of other doctors doing this work, but I just think me personally, I always love working with the urban underserved community, and it's just something that it brings me joy to be able to do this.
And you see that you're making a difference.
Yes, yes.
So you're going into churches.
Yes.
And you're giving you're bringing this health message.
Correct.
Through churches. Now, why that avenue?
Well, so in the Black community, so the churches is the backbone of the community. And so one thought was to do a faith-based initiative, so to educate pastors and mothers and deacons and family members, so then that way not only will we target the medical part, but have that peer support, that spiritual support too, that a lot of people need when it comes to treating any type of substance use. So one of my ideas was to go through the churches, educate the community, activate our community, bring resources, therefore we can create this cultural change.
And so what are you educating on exactly?
Yeah, so I'm talking about opioid use disorder. So that's the correct medical term for opioids. And just for people who don't know, opioids are heroin, fentanyl, Percocet, oxycodone. I'm also doing education around Narcan use, which is the reversal agent, and then giving out resources and treatment information so people will be aware and know where to go for resources, or if someone have a loved one, they'll feel educated and empowered to be able to help that loved one.
Yeah, so and do you have a regular schedule of where and when you'll be speaking?
I don't have a regular schedule. Right now, churches are contacting me. I'm scheduling them with my assistant. So people is getting a message out. So as people hear about me, I'm just kind of scheduling as I go. Typically, I just tell people, reach out to me and I can get it on the schedule. So.
Yeah, so you go into the churches and you do like a special evening or?
Yeah, normally maybe like right before Bible class or on a Saturday, sometime during the evening. And after the training, each church would get a certificate being recognized as trained in opioid crisis management. Then I also leave a supply of Narcan, so in that way they can give that out to members or church members or community members as well.
All right, very good. We're going to take a quick break right now. We're going to come back, Dr. Turner, and talk more about the work that you're doing here in the St. Louis community for opioid awareness and resources. So stay with us at STL Live. We'll have more with Dr. Turner right after this break.